Hello, everybody, and welcome. Thanks for joining us. My name is Christian Pavarelli, and I am the founder of We Are No Code. But I'm also going to be moderating this super exciting panel and discussion. This is Moonshot House's Roundtable. It's always such a pleasure to be able to be a part of this because it's very casual and it's always incredibly informative. We dive into different topics that are super sort of interesting, and we just see so many different perspectives too. So for the sake of this, take a little time to sort of turn off some notifications that you probably have in the background. I'm sure that, life is distracting at the moment, but the more we can, the more that we can share and the more that we can sort of all participate is going to make the experience a lot better. I wanted to thank everyone from the Moonshot House, including Alex, which in my screen is right below me, but also Hanye, who is in the background. She is my my left-hand woman. I don't know if that's something you say, but there you go. And she's helping out with all the technical side. She really is just doing a fantastic job in bringing amazing panelists and also running the show. So thank you so much for doing that. We have some super exciting people to present to you here on the panel, so I'll go through those one by one. We'll start off with a couple of champions. So the first person that I wanted to sort of welcome and introduce is Tracy. She is a former partner at Google Ventures and has experience in entrepreneurship as well as a bunch of other areas. I'll let her explain to you what she does, what her background is, and that'll probably be a better introduction than I can make. Tracy, welcome.
Thank you. Hi, everyone. So I spent the last 10 years at GV, Google Ventures. Reminder that don't know, is the non-strategic VC arm of Alphabet / Google. My role for the last 5 years has really focused on partnerships. I started that group at GV, and what that means in the context of VC and startups is connecting our portfolio companies and startups with the largest corporations in the world. So always speaking with heads of innovation, CIOs, corp dev teams, and corporate VC teams to really help connect them to new technology. And then I also did that on behalf of Google as well. So Google is such a large place. It was really exciting to connect Googlers with new technologies or find strategic partnerships for go-to-market and channel sales. And as he said, former. So the next thing is confidential, but I'm sure you'll hear about that in the next few months.
Super exciting time right now. I've seen actually a lot of people who are like kind of changing positions throughout this this pandemic. I think we're all getting a little bit more time to reflect on certain things, and that may sort of bring upon certain changes, which is always sort of a good thing. Excellent. The next person I'd like to present to everyone who's here watching is Taylor. Now, Taylor has a great background. I've known him for a pretty long time now. He is the CEO and founder of Scale Health, which used to be called Scale LA. You might have known it through that. Taylor, how are you doing today?
I'm doing well. Christian. Thanks for having me on. Really excited to be here with you all, and thank you to the Moonshot House family for inviting me. As Christian said, my name is Taylor McPartland. I'm the CEO of Scale Health, which is still based in Los Angeles, but we are a global health innovation ecosystem. By early next year, we'll probably have around 7 hubs around the country, all focused on really doing the blocking and tackling for health innovators and health startups. Currently, we work with about 250 startups around the world, about 100 funds, and several hundred strategic partners and relationships, and leverage technology to be able to connect the right dots at the right times, so that when something like COVID comes up, we are hopefully doing our part to make sure that the right smart people are in the room with one another, so that we can get to a solution as quickly as possible and get it into the hands of those that need it most. My other hat is that I'm the chairman of the Scale LA Foundation, which has recently partnered up with Blue Shield of California to run initiatives designed to work for and with high school students in the Compton Unified School District to be able to develop mental and behavioral health solutions for needs that are specific to them. So more than happy to keep the conversation going with anyone that wants to chat further, but just really excited to be here.
Yeah, I know that's really cool. Great to have you. And honestly, right now, more than ever, we realize the importance of health tech. Love what you're doing with the foundation. I think LA right now is really doing a bunch of cool initiatives when it comes to underserved communities and you know, of the likes. So awesome. The last champion that I'd like to introduce you to is a man who has just IPO'd. His name is Q. Q, would you please sort of tell us a little bit about yourself and what has brought you to this table today? Oh, I think you're on mute. You might have to. I'll ask you to unmute. It's saying you might have to click a little.
Thank you. Alex dragged me to this table. I had the fortune of meeting him several years back, and we've struck up a great friendship and have helped each other along the way in different ventures and different journeys, beginnings and ends. So my background is primarily in advanced technologies and trying to break new ground, whether it's in underserved markets in rural areas and broadband, going back 10 years and 15 years ago, to introducing the original BlackBerry, the converged wireless device in cellular and data form, to the marketplace back in 2000. But most recently, as you mentioned, what we did was earlier on this year, I was helping the University of Colorado Medical School as the pandemic was it was breaking out, but it wasn't known yet in January. So I was on calls. We were evaluating different technologies with the CU Innovations Group. And in that process, I came across a founder / inventor who had been developing for 3-4 years UVC technologies around hospital-acquired infections, and he happened to be, through a series of very convoluted ways, in the luxury mirror space, and he was developing this technology to sit underneath mirrors to cover the sinks where a lot of the studies show 80% of hospital-acquired infections happen, and 99,000 patients in US hospitals die of HAIs every year, and about 1.4 million infections like staph occur. So in terms of capital formation, we had, we're basically a startup, and I got to know our founder, Max, pretty well, and I advised him as the pandemic was worrying that, we get on the field. He happened to have audited statements. So instead of going through the private route, both because of his intentions for the company and his intentions as an investor, NASDAQ and going IPO was the best way. So the threshold for NASDAQ is to raise $5 million. And so we set our path and our goal towards that path, and we managed to sprint along the pandemic path to get everything put together, and did a rapid roadshow and closed on September 1st and went public. And just last week closed a secondary offering to fund the rest of the plan to get up off the ground and into the marketplace. And we've also already announced an acquisition besides our UVC product that uses a process called photocatalytic oxidation to take care of air purification that's non-filtered air purification. So it actually kills viruses or carbon-based pathogens and organisms that was developed for NASA. So I am, to some degree, I know some of the members of Alex's group and the Moonshotters pretty well, and I've done business with several that have been on this before. David Walsh, I think, is one of them. That David and I know each other, and both introduced Alex to him as well. And so that process, a little bit of entrepreneur, a little bit of opportunist here with our IPO to try and get a health and safety and public health safety solution funded and in the marketplace.
Love it. That seems like an incredibly diverse and very, very deep sort of set of skills that you have there. So excellent. So let's kick this off. I think I'm going to introduce you to some of the others that are here. We have 3 presenting companies. I'm one of them. But before that, I'd like to introduce you to Lucas and to Hong Hao, who will each be talking about their startups. We're going to go through these sort of one by one. The idea is to keep it very conversational, very casual. This is not a pitch. This is for us to really talk about what we're working on, and then start having an open conversation with other people on the panel. Q, by the way, I believe that you have a little bit of an echo in your background. So I put your microphone on mute. So maybe you want to check if potentially putting on headphones might help or something. So with that said, maybe I will ask sort of the first presenter here to tell us a little bit more about his company, which is called Allergy Amulet. His name is Lucas, and he is not the founder, but the CTO of this company. Lucas, how are you doing?
Hi, Christian. How are you doing? I'm very well, thank you. Thank you for giving me the opportunity to present a little bit more about Allergy Amulet as well. It's very exciting. So yeah, as you mentioned, I'm probably a little bit different in terms of I'm not the founder. However, I'm an active CTO. I've actually been working as a scientific advisor for the company for approximately 2 years, coming full-time as a CTO a few months ago. So as you've mentioned, initially some people are shifting positions during the pandemic. So yeah, no, just to kind of give you maybe a little bit of background about like what we're trying to do at Allergy Amulet. So Allergy Amulet has been initially founded by Abigail Barnes, who is a founder and CEO, but it's actually more like a personal mission. So Abby itself, actually, she suffers from food allergies. She's been hospitalized over 6 times during her lifetime. And as a kind of like trying to change it and address this problem, that there's so many people in the world, and I can probably imagine that it's whether maybe some of you are having some food allergy, maybe your friends, your colleagues, that actually suffering from that is very difficult these days, because even trying to go to the restaurant, trying to eat out, or even going to the supermarket every single time having to just check your food products whether they contain a given allergen, and often you get this disclaimer saying like it may contain, it's being manufactured in the facilities containing. So it kind of like, it's very vague. It doesn't really tell you much. And what we're trying to do, we're trying to address this problem by making devices that are capable of actually detecting those food allergens in foods within 60 seconds. It's essentially a consumer type of device, almost of the size of a USB stick. So you can take it anywhere you want to, and whether you go out, whether you travel abroad, whether you go to a dinner party, and you can take a given sample and analyze it, and will tell you whether a given food contains an allergen or it doesn't. Just kind of to put it a little bit maybe into context, because I know I've mentioned that people are typically aware that like lots of people have food allergies. Actually, if we're looking just at America itself, United States, over 32 million people at the moment suffer from food allergies. It's 1 in 13 kids and 1 in 10 adults at the moment. And actually, prevalence of food allergies is growing. You can develop allergies at any time in your life. So it's not uncommon that one day you become 40 and you wake up and you see, oh, actually, I cannot have that milk because something is happening. So the unfortunate thing with food allergies is that different people, different individuals react very differently. You've already probably heard of cases that, you can eat as much as like a pea-size amount of food. It could be a peanut, and you may end up going into the hospital. For some people, it could be just a mild rash. However, in many situations, unfortunately, your conditions can be quite serious. So again, what we're trying to address it through making the devices that could be available to pretty much everyone, because at the moment, if you are trying to see whether a given food contains an allergen, as I said, you're either relying on someone in a restaurant to tell you oh, can you check in the kitchen whether it has something? But you can also imagine it's really prone to human error, because sometimes the kitchen staff might not necessarily want to admit, maybe they just don't know, because, you know, maybe somewhere at the supply chain where they're getting the supplies, actually, you know, they didn't know it's contaminated. So what we're trying to do, we're trying to kind of minimize that Russian roulette when you go to that restaurant and avoid this. We want to give something to both consumers, to restaurants, to manufacturers, that they can actually do that quality control. They can check for it as they prepare foods, as they want to taste something, as they're selling it. So the way we're taking a different approach from what's common in the industry at the moment, every single time, if you want to do those analysis, you're relying on laboratory-based tests. You have to take a sample, send it over. It can take a day, 2 days. There are solutions that are more portable. However, they're much more expensive. It can cost 15, 20 bucks per test, which you can imagine as a consumer is not really, you know, you're not going to go to a restaurant to get a meal for, let's say, $10, $15 a sandwich, to later use $20 to spend on a single test and wait 15, 20 minutes to even get the result. So we're trying to make similar type of devices in terms of make it portable or minimize the requirement to send it to external laboratories. However, being able to keep it in sort of like a pocket size type of a device and giving you a readout, giving you that message within 60 seconds. And our technology in that respect is quite unique, because what we're trying, we're making actually synthetic cavities that can detect a given allergen by matching it in size, shape, and molecular properties. And kind of, I think the easiest way to equate it is if you think of like a key and a lock mechanism. So what we're making, we're almost kind of making that lock, and the given allergen is a key, and it can only recognize the specific thread, almost a specific sequence. And that's what we're trying to do. So we're actually mimicking lots of biological systems, how they detect how your body responds. However, we're making it synthetically. So we're trying to, the reason we do it that way, because we can overcome lots of challenges associated with biological systems. They're typically expensive. Their stability is much lower over time. And that's kind of one of the advantages of our technology. And by this, we're trying to essentially put this in a portable consumer device where, as I said, can be able to detect a given allergen in 60 seconds at any place, at any time. And I think one of things that we're taking a big pride of is, you know, taking our approach to data validation and how we ensuring that our results are viable, that our technology can work. And we're doing this by doing very extensive trials and trying to test pretty much any food that we can get a hold of by analyzing them in terms of, you know, how complex they are. Because as you can probably appreciate, when we're thinking of biology, of human body, you know, it's relatively known. You know, you have known temperature, pretty much known pH, you know what's there. When we're thinking of food, I mean, you can imagine if you go to like an Indian restaurant versus you go to an Italian restaurant and you think of like what's in those sauces, you know, it's hundreds of different ingredients, different compositions, textures, acidities. So what we need to make sure, we need to ensure that our technology can reliably perform in all of them. So every single time what we do, we're actually testing multiple different compositions, looking for the worst case scenarios, the most complex samples, and ensuring that our technology can give us the required accuracy, the required sensitivity, the required specificity for all those measurements. And taking it even a step forward, we also trying to be transparent about what we're doing in terms of we subjecting our data for pre-review. So we've recently submitted as well some of our data to one of the leading journals in food chemistry to essentially subject it to that extra validation. So other group of scientists can make sure that what we're doing is definitely viable and the technology can work. So that's kind of like a short overview of what we're trying to develop. We are expanding this to sort of like target the 8 major allergens, because that's the interesting part, that actually, even though so many foods can trigger different allergenic reactions, actually 8 allergens are responsible for over 90% of all food allergies in the world. So that's kind of like what we're trying to address. And the very interesting part as well, that, you know, those synthetic cavities can be modulated later to not only target, you know, food allergens, but also expand it towards food poisons, contaminants, toxins, and other different targets. So I hope that that gives you like a very short overview of what we're trying to do at Allergy Amulet. And I need to say, working with the company for almost 2 years, it's very, very exciting. And It's been a great experience. And it was a great pleasure to give me the opportunity to actually present a little bit on this. And if you have any questions, I'd be more than happy to answer.
Oh, you and Taylor definitely have to have a chat at some point completely separately, because everything that you're talking about, he has a very deep understanding of. No, this is super interesting topic. One of the questions that I had kind of just, you've mentioned sort of these different use cases, like being at the restaurant. Like, what angle are you guys taking in terms of like the go-to-market strategy? Are you guys thinking this, you want to get this into the hands of every sort of person who deals with these allergies at like a B2C play? Is it like a B2B? Is it potentially a B2B2C? Like, how are you looking at, or is this something that you're only for the moment strategizing as you develop this product?
It's actually a combination of both. So I think primarily we're looking at B2C, where sort of like our dominant group is actually lots of mothers with kids, because what we want to ensure actually that, when you have kids, which are, there's the biggest risk for kids. They're not always aware of what they're doing, and sometimes it'll be more accidental because they go to school and there is something, they're trying with their friends. So what we want to sort of like build up that confidence. We want to build up the trust that, like, actually, if you're not sure something, use our device and make sure that, that food is safe to consume. So that's kind of where we primarily look in, actually targeting to those families, so they can feel better about, having their kids, running around, going to their friends, being at school. However, we also want to focus on food manufacturing, restaurant, simply because, of course, when we eat out, there's lots of cases where, I think recently actually Preda Manager back in the UK, I think almost a year ago, there was a big case that someone purchased a sandwich. It was not supposed to contain, I believe it was peanuts. And then unfortunately a person consumed it on the plane and they just couldn't get medical attention. And unfortunately the person passed away. And it's not the first and it's not the last time that it happened. And so what we also want to do, we want to address that problem at the supply chain, at the manufacturing, where we can provide that. So actually, when it goes to later being distributed to different stores, different restaurants, we already know that that does not contain that given allergen at a certain threshold.
I have a question. At the end of, and you're right, Christian. I have many questions. But at the end, you were touching a little bit on other types of targets, and I'm wondering, just down the line, do you see an opportunity to apply this to identify the foods at restaurants that pregnant women should be avoiding, for example? Because that's something that we were very sensitive to when my wife was pregnant, around different types of pasteurized, unpasteurized cheeses, or like all of that kind of stuff. And I'm wondering if that's something that could theoretically be in the roadmap.
Sure. So we definitely would like to later think from that perspective, expanding towards different applications such food safety, pretty much food safety applications. In terms of technology, actually, its use cases, its applications are, I don't want to sound cheesy in saying unlimited almost, but essentially what we're doing, if you think in nature, most of the recognition detection systems typically work on the principles of having almost antibody and antigen. So kind of like almost a defined receptors in biology. What we're doing, we're just making them synthetically. So we essentially trying to mimic these properties. However, instead of using those biological systems, having them grown in animals, having them being extracted, we're just making them simply in a lab, in a beakers. And that's essentially the advantage of our technology. And in terms of scientific literature, there have been plenty of different examples using them for different targets. And absolutely, you can use them for detecting of things like bacteria, viruses. There have been even actually recent attempts by one of the companies in the UK using similar type of technology for detection of COVID. So there are actually quite a lot of applications where that particular system can be used.
Cool. Thank you.
Awesome. Are there other questions from any of the other panelists?
Yeah, I have one. Have you spoken with, on the health side, like insurance, health system, like how do they think about these devices? Because if you're going, you talk more about the consumer route. I have a good friend, she's a pediatric allergist, so I'm going to talk with her about this later. for sure. But any insights you've had from that side?
Yeah, so I mean, to be fair, that would be actually probably a better question for my CEO, for Abby, than myself, but at least trying to answer it a little bit. So we're having, on our board, we're having different clinicians actually as well, work in the field within the allergies. So we're having initially the discussion, we have quite a lot of support from the medical community for our type of the devices. In terms of sort of like insurance itself, I wouldn't be able, unfortunately, to comment on this at this time. However, I'll be happy to take it later offline, and I'm happy to pass those questions to Abby or connect us, and we can have that conversation later.
In terms of risk, I hope the echo's gone, but in terms of risk, what is the certain sort of efficacy and level of guarantee or confidence and certainty that you have to supply to your consumers? I mean, what do you warrant? What do you promise that I can protect my child, or by using the device? How do you manage that?
So there's quite a lot of things around messaging as well. So what we're trying to say, our device is a supplement, it's not a replacement. So, we're still encouraging that parents should be, educating their kids, and people should be, trying to see whether, if you're taking something that contains peanuts and you're allergic to peanut, then, it's most likely you will suffer from allergenic response. So what we're trying to say is like, it's a substitute, it's an extra device that you can use to give you that extra level of confidence. And what we're doing to address this in the lab, we're doing the extensive tests where we're targeting 99.7% accuracy in detecting a given allergen at scale. So that's what we're trying to verify. And by the way we're defining the accuracy, we're essentially looking at clinically relevant levels. So from lots of medical community studies, there's something that's essentially known that at what level you're most likely to see an allergenic response. So we're targeting this pretty much to the lowest observable levels at which you'll be developing those allergenic response. And that's how we're fine-tuning our devices. And at that level, we're targeting 99.7% accuracy for detecting a given allergen. As I said, it's not going to replace people's common sense and people's their approach towards allergy management. Is something that should give you that extra level of confidence. Whether maybe if you're not sure, test this and don't, and that will give you that extra level of confidence.
Very cool. I see that we are reaching the end of this period, but I think my last question for you would maybe be, where do you see this whole industry sort of going? I mean, I learned very recently that allergies develop, and more that's happening at a later age. And yeah. So where do you see this whole, I guess, this movement going over the next 20 years?
It's very interesting what you've said, because there's definitely a big trend at the moment. The more and more people are being diagnosed with different food allergies as they age. And there have been much more research recently trying to actually address this, by, for instance, feeding your children when they're young with small doses of those allergens to kind of build that immunity, that resistance. However, it does have a mixed result. So what we're anticipating, based on the current trends, and as I said, it's 250 million people globally suffering from food allergies, that unfortunately that number is probably going to go up in the future. So I think more countries at the moment, particularly Europe, are taking very protective measures in terms of passing legislations to ensure that manufacturers, don't only just put disclosures in terms of it may contain something, because as I said, at this moment it's very vague. So, by it may, you're just essentially limiting an liability, but actually, it's not really helping consumers, because you don't want to go to the supermarket to find out that every product you want to eat may contain something, because it's not really being analyzed and you cannot have it. So we're thinking that actually lots of the governments will be getting more involved in terms of regulatory bodies, putting legislations that, there has to be a certain level of analysis, whether given foods contain those analyzed or not. And that's where we think that our technology can go through essentially and offer that level of degree for both consumers and the industry.
Very cool. Well, I think that was a super clear presentation. Thank you so much for sharing all that with us. For those of you who'd like to talk a little bit more, feel free to reach out to to him as well. Lucas would be happy to hear from you. No, excellent. So we're gonna jump into the next presentation. Bringing Hong Hao sort of live, and he's going to tell us a little bit more about his awesome startup called Butler. He is the CEO, also a Harvard graduate, I believe. Yeah, welcome. Oh, I think you're, yeah.
Yeah.
There you go.
Thank you for inviting. I'm not going to be pitching, but I do make a, casual presentation. So let's see it.
Perfect. So yeah, tell us a little bit sort of what your company does, like on a high level. And then I guess I can ask a couple of more specific questions on the back of that.
Sounds great. Can everyone see my screen? Perfect. So essentially what Butler is about is this tiny eraser size sensor that can real-time track individuals' indoor movement, trajectories, postures, and also body temperature. We started from tracking this kind of things in home, but recently we got a lot of tractions in in retail and also assisted living. So let's zoom out a little bit. So the reason why we do this is really that if we think about the way people communicate, 2,000 years ago, we were writing letters, and nowadays we are using Zoom or SNS. And also like the way we travel, we started off like riding horses. Now we're on autonomous cars. But if you think about architecture, look around, we're still like a few pillars and a slab. So like MIT Media Lab City Science Group is a group that was like-minded people like me and my co-founders that strongly believe the next generation for architecture is to make it responsive. And then like if you look at the advancement in like AR and VR, the space around us is going to be the biggest and most interactive interface in the future. So like to make that happen, one of the things I want to clarify first, we are like a official spin-off of our group. And then like to make this kind of idea and vision happen, there's two parts of story. The first part of it, I want to use one of my research back then, like to explain it, is about making this kind of actuation responsive architectural elements that can create this kind of new interface that is transformative and interactive. This is a moving wall, transformative wall that can like change its shape based on my behavior, so it can shape the room into different functions. But the more important layer, the second part of story, which is the backbone to make this happen, is ambient sensing network that can real-time track people's behavior, and also like respecting their privacy means that you're not going to be able to use any sort of cameras. You're just using ambient IoT devices to detect what are people doing there, to understand what's their preference, and then what exactly in their mind trying to do next to make the whole space, to make the actuation responsive and intelligent. So that's essentially what Butler do. That's in the backbone to become this infrastructure to let our environment understand what people are doing inside and while safeguarding privacy. So that might still be super abstract. So I'm going to use a casual TV show that we were on to explain that a little bit.
So where are we going? Imagine a home that knows what you need and understand what you want even before you do. We implemented our technology into this IoT sensor network so it's responsive to your personal needs.
Sorry, Hong, I don't think I really understand.
Yeah, it's complicated. Why not let me and Corbu here show you? While we are approaching, you see the house internal welcoming mode from the blinds rolling up and also the lights on the entryway start to light up. And you see this window turn from opaque to clear for us. Let's watch what happens when Corbu runs up the stairs. Go, Corbu, go!
Are these lights especially for the dog? Wow.
Yeah, and when we walk up, the human lights will be on.
Oh, so it's like the house is alive.
Exactly. You see, Elon, the house knows what we want and what we need even before we do. This is a multi-function room in the house, and it's context aware. It knows that I'm ready to start working.
Oh, wow, it looks awesome.
See if I want to read a book.
You should pick a white one.
Okay, they're all white. The lights will be automatically adjusted for reading, and then I want to take a nap.
Oh, and the blinds. Oh, that's awesome.
Yeah, like I'll skip more clips about tracking the little corgi inside the house, but that's definitely worth watching. So, assisted living is like very similar story to retail. Like what we offer is like to real-time track individuals like indoor location and also moving speed. So those integrators can use whatever we provide to calculate the calories the tenants are burning every day, and also their lifestyle to generate reports of their well-beings. So that is also a use case currently being widely explored by our customers. So like besides like calories they burn, we can also track in public spaces, understand the usage of different areas, and then to to offer that information to sanitization technology, to like have a better sanitization schedule, and also efficient cleaning in hospital and also public spaces. And of course, about the initial use cases in home, we can certainly, with this information we get from our technology, you can make your home more responsive and also intelligent. So like looking at our technology, we think this is really the next generation wireless sensing technology for any sort of like human activities indoor, and also well-beings, temperatures, like lifestyle, and also calories they burned, that is fit for all built environment, and then all under the same umbrella that is safeguarding users' privacy, because this is a similar sensor to like the PIR sensor that is deployed in public restrooms. And then it's super easy to deploy the safeguard users' privacy. It's extremely accurate. The trajectory tracking can be as accurate as within 30 centimeters. And then it's real time, it's as low cost as a PIR sensor. So yeah, like I think like in the future, we really want to be the infrastructure replacing the current motion sensing technology. And then we recently just won Architecture A+ award in smart building and technology. And yeah, so imagine starting from retail and also assisted living, imagine a world that's more intelligent and responsive, and like safeguarding users' privacy and also health, powered by Butler.
Super cool. I love this kind of stuff. No, I think that it's like, it seems like there's so many use cases, and I guess one of the questions that I have is like, are you guys like exploring a lot of different use cases at the moment? Are you like commercializing one as you're sort of bringing to market? Like sort of strategizing and maybe doing more research and development around others? Like, what pathway do you see there?
So like we currently are strictly B2B, and then like think of us as a Intel Core i5, i7 chip. So like our main customers are integrators. We do explore different use cases and then tell them, okay, you can do this and do that with our sensors, which like current technology couldn't do. But like for us, we don't develop that end-to-end solution, the whole thing. We don't do it turnkey. Except for some super valuable customers, well, usually we don't do it turnkey. We're just a solution and a technology solution that we license it out to integrators. They can build whatever they want, just like an Intel chip. Like you can build a tablet, you can build a laptop.
That makes perfect sense. It explains the number of sort of B2B use cases you mentioned. Do we have any other questions from any of the panel members?
Yeah, I have a question. What's the range, and do you charge kind of by the sensor, or I mean, what's your pricing model for it?
Yes, like for B2B customers that is integrating our technology that we license to, we charge an annual subscription fee, licensing fee per year on the basic APIs you can get, which is indoor coordinates and also temperature. And then that's $12 per sensor. Mm-hmm. That's the annual subscription fee. And then like you're going to purchase the hardware at cost, which is like roughly $30 to like $60, depends on the volume.
Very cool.
Can you talk a little bit more about the applications around assisted living? Like that seemed really, really interesting, especially in a time of COVID, when it's it's harder for we have more people that are aging in place. We're dealing with a lot of social isolation. We're dealing with a lot of, a population that isn't as adept at adapting to new technology as needs arise. And I'm looking at my own family that's getting older, and the challenges of being able to manage lights, manage TVs, just all that kind of day-to-day stuff is certainly in COVID getting more and more challenging. And I'd love to learn more about that piece.
Yes, like there's two sides of story of this where, yeah, that's literally the use case I overworked all my co-founders and also team for recently. It's just so a lot of tractions. They're deploying to thousands of apartments in the in rather soon by the end of this year, and also like next year for this type of use case. So like there's two parts. One part is about alerts, like if someone fall down or certain kind of, activity or lifestyle that need an alert. So like they've been staying on the couch for like, 20 hours or something, or they accidentally fall down in some place. The second part is about like a long-term report on their well-being, whether they are like suitable or qualified for living in a assisted living apartment that have like, they can live independently, but there's just help on site, or they have to be transferred to a, elderly care facility where there's like 24 hours, like in surveillance. So this kind of thing is like more, so we see use case in both domain, but like the most strongest demand is really coming from regulations to require integrators or assisted living apartment provider to like to basically make sure the tenants are qualified to live there. So that's why it's very essential and important, especially during COVID. You couldn't expect a caretaker to go there and then manually, do the reports and then analyze the tenant's well-being, like through different tasks, manual tasks, or like expect the caretaker going there and every day to let the elderly, put on a certain wearable device, which is, think about how many times we forgot to wear ours, like, Apple Watch. So like to do the summary report, you need to be very consistent. And also like you need to have the tracking always there. That's like the safe, that's the umbrella there that can provide that that level of like, care.
Super interesting. We are actually reaching, we're a little bit above, sort of past the schedule time. We have one more presentation from myself. That very good presentation. Hong Hao, if anyone would like to have a chat with Hong Hao about all these amazing applications that you can use his technology for, reach out to him on LinkedIn, reach out to him by going to the website that has been posted. It's livebutler.com. And yeah, really excited to see the progress there. So I guess for the last segment, and we'll keep this relatively short, I'll talk a little bit about my company, which is called We Are No Code. I'll probably make it a little bit more storytelling so that people can really understand. But it all really starts with my own sort of personal journey. It's been about 15 years that I've been building companies, startups specifically. And about 3 years ago, I was asked to become the director of a pre-accelerator program that's called Startup Boost in Los Angeles. So we trained throughout that program about 100 startups who went on to raise more than $40 million and got into sort of some of the top accelerator programs that also invest, like Y Combinator, Techstars, 500 startups. And it was really at that point at which I realized there was kind of this fundamental problem that was happening. And it was usually a problem that was happening within the non-technical segment of the market. So non-technical founders in general, I was sort of looking through about 200 to 300 applications every 6 months of startups and noticing that a huge problem was product. How do I get this app built? The options were kind of limited when you were non-technical. Either find a technical co-founder, in which in many cases that is a little bit frustrating. A lot of separations cause sort of the demise of startups. But then also it's kind of like finding a perfect person who you want to spend the next 5 years building a company with is complicated. Then everyone knows that, developers can be very expensive. So some people don't have $30,000 to $50,000 to throw towards building your platform. And oftentimes what I was seeing was that most people who were kind of going overseas because they were getting good deals for sort of building out technologies, what came back was just unusable spaghetti code. That's what we call it internally. And they were having to go through all these things about, oh, how can I now transition this into new stack? Anyway, the options were not great. And I was just seeing hundreds and hundreds of founders going down this road that usually was something like 50,000 to 500,000 and 18 months of their life with not much progress to show for it. And that's when I realized, like, about 5 years ago, I discovered this technology called no code. So it's basically it gives you the ability to build software without having to write individual lines of code or understand coding language, but you were able to build apps, mobile apps, web apps that range from anything from sort of messaging apps to marketplaces, and all that without coding. And the day that I started working with some of these tools, it completely changed my journey as an entrepreneur, because it really changed that period of time of trying to build something, bring it to market, from this sort of one year period to like over a weekend. I could build things, launch them, understand the analytics. And so basically we've evolved. It's sort of just an evolution of coding, which says, like, every other industry is not sort of managing things with code directly, but web people are still really adamant about sort of building software, writing individual lines of code. And so, my personal experience of that and that of my co-founder, which is in building endless SaaS platforms and sort of technologies, leveraging these no-code tools, we built We Are No Code because we realized that the problem was no longer the fact that those technologies were not around. The problem was that people weren't getting the support and guidance to be able to leverage them with their end goal in mind, right? A lot of people are not looking to build a product. They're looking to build a startup. They're looking to build a business, or they're looking to build software internally for their employees because out-of-the-box solutions are not working. So we essentially committed to saying, okay, our experience in sort of entrepreneurship and in the startup world is really valuable, but unless you have the hard skills of building, launching, and testing, it ends up in analysis paralysis, right? And if you're really good at product, usually you're building products that no one cares about. So we essentially combined both those methodologies, and we really have a program right now, which is our flagship program, which teaches people how to build startups leveraging no-code tools. So it's kind of like the mix between a no-code product school, where you're learning several of these tools, together with a sort of lean methodology startup accelerator. And in that way, we're able to really get people to see the progress, non-technical people, to acquire these skills, to be able to launch companies much quicker and test them out into the market, and acquire first sort of paying users. So we were really fortunate to actually hit a problem that people were having, like, in every single entrepreneurial community. And people like Taylor and I sort of hopped on a call, and he's like, well, there's people in our community too. So we've started building partnerships with companies like Scale LA, but also as well, we were called by UCLA Accelerator because one of their teams went through the program after going through both their accelerators, and there was this idea that, yeah, this product piece is something that we can't necessarily help them with, or that we're not currently doing. A lot of these entrepreneurial communities are focusing on providing coaching, on providing sort of pitch practice, helping people with their pitch decks, financial forecasts. But when it comes to actually like the building of these technologies, there's still a big gap. So that's what we're really focused on. It's been amazing. We have sort of students in more than 12 countries, and these incredible partnerships that have been developing. Both me and my co-founder, we believe that it's important to democratize these skills because the implications are massive. We're talking about hard skills, so it means that someone with no funding, no investors, and potentially zero startup experience would be able to sort of grasp these programs and be able to sort of very quickly up their game as entrepreneurs, but also learn the skills to build these platforms themselves. So just to give you a little bit of understanding of the magnitude. Right now, 0.3% of the world knows how to code. So not even 1%, a third of 1%. So all the experiences we know on the web that have been developed by those people. And usually, as we all know, those are usually white men in California. Oops, I'm in California and I'm a white man. But the point here is that what happens when you put these technologies in the hands of people who come from completely different backgrounds, right? People who have very specialized industry background, people who are in the creative industries, and frankly, like I believe that the new generation is really well set up to be able to learn these skills. Instead of taking 3 to 6 years to learn how to code, you can take 3 to 6 months to become an amazing no-coder and really like empower yourself fully as a founder. Because the problem is when you start working with external developers, you're always going to have to go back to them for an edit here, for this thing there. So our entire mission is to really democratize no code, but always focus on the human first, saying, hey, it's not just about acquiring these skills, it's about applying them in a way that makes sense for your sort of end goal. So that's essentially what we do at We Are No Code. And I invite any additional questions to this topic, which I'm incredibly passionate about.
Yeah, thanks, Christian, for sharing that. Super excited because it's two themes that I keep looking at and thinking about is A, no code, and I brought it up in a talk I gave yesterday, and then B, how education just needs to change. And we're seeing that especially right now in COVID. And how do we allow more people to build companies? My question is, in terms of how you expand this, are you partnering with universities and other school systems, which is part of the broader, like, how do we reach more people? How do the UCs reach more people? Now that the California population is so high and their acceptance rate is so low, what are you thinking about in terms of that?
Yeah, it's a very interesting question because right now we are on the sort of in a place where the education system is being put in question heavily. And I think that's kind of natural with COVID going on and online learning becoming more of a trend. But I think what's really happening here is that we need to understand that the system that was designed during the Industrial Revolution, right? And so that was to get people to have a specific, to essentially be good workers. And at first that was factory workers. And of course, education has developed a lot from there. But the bottom line is that when you see companies like Apple and Google moving towards only skill-based recruiting, heck, we got to start teaching our kids hard skills. So I think that's a really big thing. And that's one thing that we're adamant about. We teach people how to do things, not just telling them what to do. That being said, I still believe that sort of 1 to 18 education, at that point, it's really important to teach people how to learn. I personally went through sort of the international baccalaureate program, and they're really adamant about teach someone how to learn so that they can apply that process. What I'm thinking is maybe we should start thinking about, hey, if someone wants to become a marketer, maybe we want to teach them how to actually do paid ads, SEO, influencer marketing, all the hard skills. Because if not, they're coming out of a 4-year university degree and they're heavily in debt in this country. And unfortunately, they're still lacking a huge number of skills. We provide a lot of context, but only when it comes to pointing people towards doing things. So I think basically, we are partnering with some of these people. UCLA Accelerator reached out to us. We do talks at USC. I've been on a panel for Pepperdine as well. We're really encouraging people to reach out to us because we can provide discounts for their communities, and we can also find ways to do that at scale. We're also looking at this as in right now, people are trying to help underserved communities. We have an incredibly scalable model to be able to train founders and really move the needle. And if corporations are interested in actually sponsoring underserved communities to go through a program like this, I can tell you that we are getting crazy testimonials from people who have, and I know because we started doing the tests. I gave out a free program to a company called Defy Ventures. They take post-prison inmates, and I actually went to prison myself for an unrelated reason. No, I'm just kidding, for the program. And we had this individual, had basically spent years and years and years in jail, really disconnected when it came to tech, was able to take this and start building. And for me, what that essentially showed was that this has really big power, and that if we can get some sort of larger companies who are sponsoring and trying to help with regard to this very real problem that's happening in the United States, but I think globally, we can be their partners to do those kind of things. So yeah, we basically have been B2C up till now. And now we just have so many lovely testimonials, and we have a couple students from Scale Health who are just doing great as well. One of our startups just won the pitch competition for the .LA event, which was sort of, so it's just like we're starting to see all these success stories, and we're leveraging those to be like, hey guys, look, there has to be something has to change. So usually we're looking to partner with these educational institutions. Unfortunately, sometimes those can be very slow moving. So we have to find relatively detached partnerships, but we're in a phase where we're starting to really look at B2B, and next year we'll definitely be deploying something where we are essentially providing not only the program, which is sort of online, but with a lot of support as well, to accelerators, pre-accelerators, sort of innovation initiatives, and all of that great stuff. Any other questions?
Yeah, how do you in an online community, how do you get above all the noise? Because I mean, you have a much more structured approach, but in lieu of all the sort of kind of trucking school, vocational stuff, there's just so much. Like, how do you make yourself distinguish, but level to institutional 100-year-old practices for what is certifiable education?
That's a great question. So, I mean, we're definitely moving. We know that this is going to be a career moving forward. We know that this is going to replace the, oh, look, I know how to do Excel and PowerPoint on a resume. We know that people will internally. So when we talk about no code, first of all, what I've been talking about until now has been really the building software side of things. We are also very specialized in small, medium business automation. Every single company is going to want to upskill their workers to have 3 times the productivity they have. And so, to answer your question, it's through results. When we get a student who does incredible things, we take that and we have open up conversations with other people. And then I think that as these organizations are shifting over, they'll either be very excited to partner with us, and we really encourage that. We're not trying to disrupt, but this is something that is happening naturally. We're just sort of trying to help the people who have different goals achieve those. Awesome. Well, if there's any last questions, now is your time.
I'm good.
Very cool. Awesome. Well, yeah, no. And if you'd like to reach,
didn't get a chance to ask questions, but because we are out of time, hopefully next time.
Exactly. We're over time, and we want to be respectful of the fact that everyone joined. I'd like for any one of you who's willing to fill out a short survey that we're going to be putting in the chat on the right-hand side, asking you just for a little bit of feedback about this roundtable. I also want to thank everyone who's been here: Tracy, Taylor, Alex, Hong Hao, NQ, and Lucas. Thanks so much for joining us. It's always such a pleasure to put these on. And I just always enjoy just hearing these completely different companies sort of pitching and so thanks for that. Again, you can reach the founders and the other panelists usually on LinkedIn. Does anyone else have a preferred place that people can find you? Speak now or forever be, I don't know what the expression is. There you go. So thanks so much for joining us. And again, thanks to the Moonshot House for putting on this amazing roundtable again. You guys are really the best. I've just loved being a part of that community. LinkedIn is good, but I think all of us are starting to get a bit tired from those automatic messages we're getting through that. And I think that Moonshot House does such a great job in curating the people that they bring to their community. And it allows us to spend our networking time more productively. So thank you to Alex. Thank you to Hanye, who's behind that beautiful Moonshot House logo, which is a redesign, by the way. Congratulations. And we'll see you guys at the next roundtable. Have a great afternoon and take care.
Thank you.
Thanks, everybody.
Thanks.
Thank you.
Everyone.
Thank you.
Bye.